Shocking news tonight in the world of celebrity. Celebrity chef Anthony Bourdain was found dead in his France hotel room. CNN says Bourdain was working on his series Parts Unknown, which airs on the network. They're calling his death a suicide. It happened the same week that designer Kate Spade also killed herself in the bedroom of her New York City apartment. Suicide rates are on the rise, and now local mental health experts worry Spade and Bourdain taking their lives may trigger others to do the same. The death of the prominent figures could cause people to feel helpless about their own problems. 7 News' Stephanie Borman found out suicide happens oftentimes without warning. Stephanie.
Tom, no one is immune to mental health issues. The CDC reports half of all suicide victims have no previous mental health problems. There are many avenues for treatment, but experts say getting the right help begins with simply asking someone if they are having suicidal thoughts.
Sometimes it's just there's not signs. And honestly, those are the ones that usually follow through.
Suicide research shows the decision to attempt suicide is usually done on impulse.
It's a permanent solution to a temporary problem.
Mental health therapist Courtney Watford says it's the people who seem to have it all together, like Kate Spade and Anthony Bourdain, that often succumb to their self-destructive actions.
Wow, they have to deal with that and we didn't even know it. So if they're dealing with that and I'm already kind of in that place, then things must really be hard. Rocky
relationships, financial struggles, problems at work. There's usually a number of factors that cause someone to think about taking their life.
Suicide is really an unfortunate attempt to stop people's pain.
But mental health experts say the reality is the pain doesn't go away. It's only transferred to the families victims leave behind. But suicide can be prevented through intervention and treatment. That's where PJ McEnroe and his team at Emerge Family Therapy come in. They are part of a task force that work with patients in the Upstate struggling with mental health problems.
Because of this behavioral health task force, looking at the greater good for Spartanburg, Cherokee, and Union counties, we're able to focus in and to pool resources to understand what one agency is doing versus the other agency, and make sure that we're making really good referrals across that network.
So I know we touched on it a little bit in my story, but this is the full guidebook.
Sure.
And it gives people not just counseling, but also like Meals on Wheels. I mean, anything that could be affecting your mental health, there is options and avenues to get help.
You put an interesting phrase in your story, just trying to make the pain go away. I guess the good news to find in all of this is that there is help out there, and this booklet could be a good start for folks.
And I'm sure many people are thinking, you know, I might not have the funds to pay for this, but the resources here are totally free if you can't afford it. So just because you don't have the money doesn't mean you can't get the help that you need.
Very encouraging. All right, Stephanie, thank you. And we have a link to all the services Stephanie is talking about on WSPA.com.